Hello, my name is Timlin. I'm a GP, general practitioner, and would like to give you a few practicals on some things that you can do. Look, I share this with a little bit of trepidation because things are changing all the time, and so be mindful of things that may be okay to do now, today won't be okay in a week's time, depending on the situation. So there's four things really to break it down which could be helpful. Firstly is prepare, secondly prevent, thirdly support medical care, and fourthly and finally recover. So in terms of being prepared, I think activities around the home, and so again the idea of social distancing, stay at home as much as you can. So even with our family, we're doing things around the dining room table, talking, sharing, we're inventing some new games. 20 questions have been a good one. Another one called Contact, you can look that up on YouTube. We have also given in to signing up to Netflix and Disney Plus, and so we're trying to limit the screen time, but obviously that can be sometimes a fun thing to do as a family. Ensuring that we have enough groceries, so we're trying for at least a week's supply. My boys at home eat a lot, so the supply diminishes very quickly. And then things like medicines, sanitary products. I think, look, important things, just soap, and water, making sure that we're having regular hand hygiene. Hand sanitizer, I know, is very difficult to get. I think I managed to get this from my local chemist. I asked for 3 big bottles and they gave me this little one here. And again, we have supplies in hospital, but again, getting supplies at home is difficult, but I would say just regularly use soap and water. Look, in terms of the groceries, again, my wife is very good at making sure we have veggies, some meat, and just the whole foods to keep us healthy. The other thing with medicines, there are some medicines now that have been found not to be helpful with COVID19, so anti-inflammatories have been one of them that have been mentioned. So that's Nurofen, ibuprofen, and using acetaminophen or Panadol as an alternative. But again, keep your eyes on things as they develop and unfold. So that's prepare, be prepared. Number 2 is prevent. So be a good personal example. I think slip-ups are so easy. I'm sort of reminded I might be putting on a mask and think, oh no, I haven't actually sterilized my hand, and so then the face mask is actually contaminated. Just the social distancing, it's very easy to forget that, oh no, 1.5 meters, and so those slip-ups are common, so just be vigilant with that. And be up to date. It's a moving target, so I use the Department of Health and Human Services website. There's a hotline as well. So again, I think that's really important because the information is changing all the time. So think of your own Department of Health and use that regularly. I think being an advocate. So remember social distancing. It might be just making sure you supervise your own children and you stop situations which you think, no, this is actually too risky. I think also be aware of the types of prevention. So we have 2 kind of groups. One is the quarantine of people who are sick or suspected or confirmed cases of COVID-19. And so they're the group that we want to quarantine so we don't actually spread the disease further. And the second group is those who are isolated because they're vulnerable. So it'll be those who are not sick but maybe are older, the seniors, people with cardiovascular disease, diabetes, also lung disease. And so they're the ones that we have to be very mindful of. So we have my mother-in-law who's over 90 and she's at home alone. And so again, we're mindful that we're not going to go in and with the kids and visit her. We'll be at a distance. We'll make regular calls. We can organize grocery dropping off. But again, we have to be mindful of keeping her isolated. And I would say it's very much like just putting a cotton ball around them. Thirdly, support medical care. And if you really want to support it, don't get sick yourself. So I think stay healthy because then you will be using that valuable resource. And I think then secondly, it would be around just encouraging health workers. It is stressful. There is fear, anxiety. At the same time, a lot of hard work going on and fatigue. I was actually sick this week, and so as a healthcare worker I can't go into work because I'm sick, and in the past I might push through if I'm just a little bit sick, but this time it's any sickness at all, stay at home and get tested. So I was tested, and there was anxiety again around, okay, am I going to be positive, and if I'm positive, what does it mean for my patients? And fortunately, 2 days ago it was negative, and it was just a big relief. So again, I think be mindful of healthcare workers and just their feelings, and that they're only human. Support maybe their family members as well, as they're out, maybe working extra hours. And then think about the skills that you may have that you can use, and be mindful with this changing situation as well. So the fourth one is recover. So again, hopefully we can all get through this and recover through this. So I think it is about helping those who are most vulnerable. People may have lost their jobs. People may have existing mental health conditions, and so this will be a particularly vulnerable time for them. People may have loved ones who are sick. It would be about checking up on neighbours, and so we might do our routine walk around the block, and again keeping that social distances, just checking up at the doorstep on how neighbours are, if they need anything. It might be delivering of groceries, it might be just that phone call, that daily phone call. And remember your self-care as well, that you've got to keep yourself encouraged and motivated, because if you don't, then you can't actually help anyone else. Maintain good mental and physical health, and then that all together, I think, maintain really good spiritual health. And some kind of ideas around especially the mental and spiritual health would be, think about what positive, what nurturing activities have you planned each day? What have you planned today that is something positive for yourself? And maybe you need to plan a few more activities that will keep you upbeat. It might be as simple as practicing daily gratitude exercises. What 5 things am I grateful for today? It might be doing some exercise. It might be having a little area set up in your home where you can do regular exercises. It might be having a walk in the garden and smelling the flowers, the roses. Good spiritual health. It was very encouraging this last week to hear our Prime Minister, Scott Morrison, encourage people of faith to pray. And in fact, this last week as well, we had a worldwide, the International Churches of Christ held a worldwide day of prayer and fasting. And it was great to be joining together as a family in that. And so let's continue to ask God to, on a daily basis, to stop this virus. It reminds me of a time working in the prison system, and I remember a number of people being very anxious and worried as they were isolated and away from loved ones and going through trials. And I remember a number of prisoners actually saying, I've just picked up the Bible and I've started to read it, books like Philippians and Romans, and even as I was seeing them as a medical practitioner, how they were themselves saying, it's actually taken my depressive symptoms away, and I found comfort in this book. And so I'd encourage us as people of faith, as Christians, to continue to rely on God. And it's amazing because I think of the Apostle Paul, who was actually in prison as he wrote the book of Philippians. And in Philippians 4, verse 4-7, it says, "Rejoice in the Lord always. I will say it again, rejoice. Let your gentleness," that's a good one in stressed out household as well. "Let your gentleness be evident to all. The Lord is near. Do not be anxious about anything, but in every situation by prayer and petition with thanksgiving, present your requests to God, and the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus." And so, think about that. Someone in prison can say that and live that out as God was close to him. And, 2 millennia later, these words can hit home to us as well. And so as my family have been praying together, I've noticed the gratitude has increased. I've noticed laughter at the table. And so I'd encourage us to stay grateful, stay close to God, and really think about imitating Jesus in loving others, being careful as well. Thanks for listening.